Dorothy, welcome.
Hello, good morning.
Good morning. How are you doing?
I'm great. Thank you for having me.
Amazing. And let's talk about let's start with your foundation. Really, what led to you deciding that, regardless of all the amazing things I'm doing, let me also have a foundation and start it?
Well, I think my cancer story started, I guess, when I was 29 in the United States. I was living there at the time. And at the age of 29, I was diagnosed with breast cancer, stage 3 breast cancer. That was life-changing. Went through the whole, surgery, chemo for 6 months, everything. And then after that, having survived that, thank God, I moved to Ghana in 2010.
Right.
And that's when I decided to, 2010 I moved to Ghana, 2013, after the loss of my father, I felt like giving back to society. And in the time that I'd been here, I'd started encountering a lot of women with very late stage breast cancer. So in 2013, 2014, I decided to establish Dorothy's Hope Foundation. And with the intention to educate, empower, and also encourage women with the disease, and also support them. For those who are underprivileged, who can't afford the treatments, the foundation supports them through it.
And how's the journey been so far?
Interesting, long. So 11 good years now, I think.
Yeah.
It's been challenging, at times, having to deal with inadequate health system, especially in the rural areas. In Accra, we have a few facilities that, cater to those who need treatments, surgery, etc. But there's a lot of work that needs to be done. With breast cancer, early detection is key.
Right.
Okay, I believe in preventative health care. So early detection and screenings, and doing your mammograms on time, it's really, really important.
And talking about early detection, we've realized that with most or some of the cases here, it's not even detected early. So the women get to know when perhaps it's at stage 3 and other stages. How dangerous, in the work you've done so far, how frequently have you come across these situations?
Well, let me back up and give some stats. So basically, you got about, in 2020, there were about 4,400 women in Ghana diagnosed with breast cancer. Out of that, almost 2,000 of them perished. And then what happens with that number? We found that about 70% of women are catching breast cancer at a late stage, which is very, very high.
Yeah.
There's a lot of reasons, factors that I think contribute to that, and that is one. There's a stigma associated with cancer, and breast cancer especially. It's taboo to talk about. I remember when I first came and I was talking about it openly on TV in 2013, 2014, and telling my story. Initially my mother was like, "Oh, no, don't, keep it private." And I'm like, no, because if by telling my experience, if it can actually save even a single life, then I'll do that. So basically, catching it at a late stage, is taboo to talk about. Sometimes lack of facilities for screening, early screening, lack of education. Okay, so I'm very big, the foundation, we're very, very big on educating communities, doing outreach, programs. We go all over the country, we screen. We've done every region up until now, with the exception of the North, which is our challenge, our mission to do this year.
Right.
But aside from screening, okay, the infrastructure is really important. We have excellent doctors in Ghana, but the infrastructure, and they're very overwhelmed as well. If you go to Kolebu on a Wednesday, there's a huge line of people.
Long queues.
Long queues. It's packed in the surgical ward. So the doctors are quite overwhelmed, those facilities that can treat. So basically, and also in the suburbs and the outskirts, you need to have established healthcare facilities that with well-trained healthcare professionals. Nurses need to be trained adequately about how to detect breast cancer, and even to do a simple needle biopsy. And also mammography machines. These things don't exist.
So we're lacking in terms of even infrastructure, health infrastructure, to be able to detect and also to help deal with the menace.
Yeah, and having the facilities there that people can walk in.
Yeah.
Women can walk in on a regular basis and be screened. And I do believe the screening should be free. So this is something that I advocate for as well. The government should have facilities where people can go and be screened for free, and basic treatments, and biopsies. and mammograms. I think mammograms should also be offered after a certain age. It should be offered for free.
Right.
Yeah.
Because, I mean, the statistics you just gave, very gory, very, very worrying that if out of 4,000, we have about 2,000 of them not making it. And these are preventable deaths, by the
Yes.
way. We could have prevented them.
We could have, if it's detected early, and then if we're proactive, and basically the women take charge of their lives.
Right.
A lot of the time, the bedside manners also, I did like to talk about this, because the bedside manners of the doctors, it's also not very good. You know, oh, you have breast cancer, and you know, you need to chop off your breast. And I always say that, you know, how you talk to somebody who's going through this horrific disease is very important. You know, you've got to be compassionate and, you know, let them understand that there is a, you know, possibility of saving your life, and you could survive this if you follow through your treatment. A lot of the time people come from other regions to Accra for treatment.
Yeah.
When they get here, they have to go through a host of treatments for a series of weeks, and you know, they don't have affordability is a factor. They don't have somewhere to live.
Yeah.
Hospitals can't contain them sometimes, and then they give up. They go back to their villages, and then they give up, and then the cancer spreads, you know, to other organs, and that's a challenge that we face as well.
Right.
Yeah.
And I'm listening to you. I can really, really feel the passion and energy with which you talk about this, and I'm wondering, this is not just what you do in terms of the foundation. You're doing events, you're doing all of these things. How do you combine all of this and still stick to it?
I multitask, I guess. I'm quite eclectic in what I do.
Right.
Professionally, I'm an eye doctor. I'm not a doctor, but I'm an optician. Okay, and basically I've done that for several years. I started in New York, where I built my optical practices. I do very high-end eyewear and optical stuff. And basically, so I moved to Ghana, and then I set up my practice. I was a move and pick for a while.
Right.
And then also Marcel Desailly Sports Complex. I had 2 locations. And so I've done, professionally, that's what I do. But I dabble in a lot of other things. You know, I love music, I love entertainment,
Right.
hospitality. So 5 years ago, I branched into hospitality as well and opened a lounge and a restaurant. So I do that also, and I dabble in music as well.
And so, when you 5 years ago, like you said, when you dabbled into hospitality, how has that journey also been for you?
It's been good. Hospitality is tough. I'd rather be an optician. Seriously, it's tough. You know how our people are. You know, it's training and making sure that quality control and, you know, customer service is on point. I'm very particular about that. So it can be quite stressful, but you know, but it's still, regardless, I've had a good run. And all these businesses, you may ask why, you know, and I've been blessed to be able to do all of this because, you know, it's very hard to raise funds. As an NGO for Dorothy's Hope, it's very, very hard to raise funds from corporate bodies or whatever. And it's been my businesses that have actually sustained the work that I do in the foundation for people in the foundation. So it's necessary that I keep working. But I think after 11 years, we have a track record now.
Yeah.
So I'm looking to open a chapter of Dorothy's Hope Foundation abroad in the States this September.
Right.
We're launching it this September, yes, abroad. And I'm hoping that through that, we can get some recognition and also some funding from external.
Because you mentioned earlier that you're seeking to do some work in the northern part of the country, which is also endemic when it comes to issues of poverty and access to the quality services. Talk to me about that briefly.
Okay, so for the north, I mean, what we're going to do is go and do our outreach and our screening, do some research and data collection. That's also something that is necessary.
Yeah.
People don't really save data or collect data. So we need to do that. For example, in the Volta region, this year, this October and actually this year, my main focus is not just the north, but also the Volta region. And I say that because over the years, I've realized that about 70% of the women who come to us for assistance are Voltarians. It's a huge, huge, huge number. Yeah. And Dr. Afram, an oncologist at the Ho General Hospital, whom I visited last month, concurred with me, and also he has the same findings. So I believe that we need to actually focus on that area and figure out what is causing it. Whether it's got to be something environmental. I mean, I know that breast cancer is hereditary to some extent, but I truly believe that it's something environmental, and I want us to delve a little bit more into that and figure out what is causing the disease. There's a 14-year-old girl that I met in the Voltarian who has breast cancer, which is extremely young.
14.
Yeah. And then I've had patients who are 19. I've had a few teenagers, 19 years old as well, Unfortunately, we lost her. Yeah, this is there's a lot of losses.
Right,
Yeah.
right.
I mean, especially in the Volta area, it's taboo.
And that's where I come from.
Oh, you're Voltairean.
I'm
Okay,
a
so then you
Voltairean.
should lobby and push for me to get funding.
We
so that
should
can,
do that.
So what we're doing this year, we did it at Kolebu last year, but what we're doing this year is I'm going around and identifying what is needed by certain hospitals, and we're actually building a cancer ward. We've been given a portion of the surgical ward at the GHOne General Hospital, and we're going to renovate it fully and equip it well enough and make sure that they have a very good facility there to treat cancer.
Okay, yeah. So if people watching us today, and they believe in your cause, they want to partner you to be able to achieve the results that we want to achieve with this, how do they get in touch with you? How can they contact you?
We're all over social media. Dorothy's Hope Foundation. We're on Instagram on Dorothy_Hope. We're on Facebook. Telephone number, I can say it.
Yes, you can.
You can call 059 399 2963. But we're all over social media, so please feel free to contact us and offer your support in any way.
Dorothy, thank you so much for coming.
Thank you too.
And I'm sure that we'll have further conversations on this particular matter, especially with the Volta region.
Yes.
I'm very interested to get to find out why 70%. Okay, we'll talk about that later. But that's Dorothy Amuah. She is the CEO of Dorothy's Hope Foundation, also CEO of Chic, Optique, and Hope Dynasty here in Accra and also in the United States of America.